NSAIDs, the gold standard for endodontic analgesia. NSAIDs or non-steroidal anti-inflammatory drugs are the mainstay of pain management in endodontics. The primary mechanism is inhibition of cyclooxygenase enzyme or COX, which reduce the formation of prostaglandins. Prostaglandins are the major chemical mediators responsible for pulpal and periapical inflammation as well as pain perception. So, by suppressing prostaglandin synthesis, NSAIDs directly control both inflammation and pain. Next comes the clinical uses in the endodontics. So first one is preoperative. Administrating NSAIDs before starting an endodontic procedure helps in reducing the intraoperative pain by lowering the pulpal inflammation. This preemptive use is particularly important in the case of irreversible pulpitis where the inflammation makes local anesthesia less effective. So preoperative NSAIDs actually improve the anesthetic success. The next comes the intraoperative. NSAIDs reduces central and the peripheral sensitization, which means by help the local anesthesia work more effectively. A good example is 600 to 800 milligrams of ibuprofen before an infraalveolar nerve block. In such cases, the success rate of the anesthesia and the mandibular molars with irreversible pulpitis improves significantly. So this has been highlighted in Ingalls' textbook of endodontics. The next comes the post-operative pain control. After the treatment, NSAIDs remains the first line choice for managing post-operative pain. So they are more effective than opioids for dental pain since they reduce inflammation in which opioids doesn't not. The best strategy for the pain relief is often combining NSAIDs with acetaminophen as it provides a superior analgesia. The next come the advantages. Compared to opioids, NSAIDs are more effective in managing acute dental pain. Opioids are reserved only for severe pains or where the NSAIDs are contraindicated. So there are also fewer systematic side effects than corticosteroids, making them safer for routine use. This dual effect, both anti-inflammatory and analgesic, makes them especially valuable in the condition with periapical periodontitis. The limitation and the contraindication. Despite the benefits, NSAIDs are not free from the limitation. They cause gastric irritation, peptic ulcer, and they also should be avoided in the patient with GI problems. They are contraindicated in bleeding disorders, renal or hepatic impairment, and in the individual with aspirin-sensitive asthma. Finally, they must be avoided in the late pregnancy, especially during the third trimester. The drug examples which has been mentioned. Among the various NSAIDs, ibuprofen is the most commonly prescribed in dentistry, usually in the dose of 400 to 800 milligrams every 6 to 8 hours. Ketorolac is a potent analgesic, but it should only be used in short term. Naproxen and diclofenac are effective alternatives, where aspirin is less commonly used due to its bleeding risk and gastric irritation. To conclude, NSAIDs plays a very important role in managing the endodontic pain.